A fever isn't an illness, it's considered a symptom of one. A fever usually means that the body is fighting an illness and the immune system is working. If your baby has a fever, in most instances, it means they have probably picked up a cold or other viral infection. Although they are less common in infants, pneumonia, urinary tract infections, ear infections, or a more serious infection such as a blood bacterial infection or meningitis may be causing a fever. Causes of fever: 1. Reaction to a vaccination. 2. Becoming overheated from being dressed warmly or spending too much time outside on a hot day. Fever signs. In babies, your baby may act differently, and they may also be crankier and fussier than usual. Poor sleeping, poor eating, lack of interest in play, less active or even lethargic. Convulsions or seizures. How do I take my baby's temperature? You can take a child's temperature a few different ways, such as via the rectum rectally, mouth orally, ear, under the arm axillary, or at the temples only using digital thermometers in children. Hold the digital thermometer in place for about 2 minutes until you hear the beep. Then gently remove the thermometer and read the temperature. At what temperature does my baby have a fever? Baby's normal temperature can range from about 97 to 100.3 degrees Fahrenheit. Most doctors consider a rectal temperature of 100.4 F or higher as a fever. When to call your doctor? Is under age 3 months and has a fever. If your baby is under 2 months and has a fever, it is considered an emergency. Seek immediate medical care. Has problems breathing or eating. Is very cranky, fussy, or difficult to calm down. Shows signs of dehydration, such as fewer wet diapers, dry mouth, no tears with crying, or sunken soft spot on the head. What should I do if my baby has a fever? Your baby is under age 1 month and has a fever. Contact your child's doctor right away. For older babies, try these tips. Bathe your child with lukewarm water. Always check the temperature of the water on your wrist before washing your baby. Dress your baby in a light layer of clothes. Give your baby enough fluids to avoid dehydration. Those fluids should be breast milk, formula, and electrolyte solution or water, depending on the baby's age. Ask your baby's doctor for guidelines. A dehydrated baby may have fewer wet diapers, no tears with crying, or a dry mouth.